I mean, I think ctDNA has been validated as an independent risk factor for recurrence in especially colon cancer. So certainly, it's become a standard of care that patients after resection for colon cancer and chemotherapy undergo MRD evaluation or monitoring using ctDNA. And that has shown that patients who clear the ctDNA after adjuvant therapy benefit in terms of improving their disease-free survival. In other types of GI cancers, it's still being evaluated. In pancreatic cancer, people have been evaluating different ctDNA platforms and tools to assess for minimal residual disease. The data is still evolving. There are some studies, small studies that have been completed, single-arm type of studies that have shown that if ctDNA is present, detectable after surgery and adjuvant therapy, then the risk of recurrence for these patients is very high, 90 to 100% risk of recurrence. So I think it does have value. Obviously, we need better treatments or better treatment strategies for these patients if they're MRD positive or ctDNA positive after surgery and adjuvant therapy. I think that's where the challenge is. If we detect positive ctDNA, but if our tools for us to treat these patients is limited to chemotherapies, which these patients often would have received as part of their adjuvant therapy, then it's hard to specifically target them and improve their survival. But if we do have other novel treatment strategies that can specifically target these circulating tumor cells or the cancer in general, then I think it has value in terms of its utility to improve patients, to predict responses and improve their survival as well. So one such clinical trial is the Tesla clinical trial, which is ongoing here at the University of Kansas Cancer Center as an investigator-initiated study where we're evaluating the vaccine against Kras plus minus a checkpoint inhibitor for balstilimab, which is a PD-1 inhibitor, in patients with pancreatic cancer after surgery and adjuvant therapy. And if they're ctDNA positive or MRD positive, then they would be eligible for this novel treatment strategy. So those would be the kind of treatment approaches that we need to really, come up with and design studies where then hopefully we can clear the ctDNA, take care of the circulating tumor cells, and that could potentially translate into disease-free survival and overall survival benefit.